Hello, this is Dr. Karen Underwood. I am the Chief Medical Officer for Drowzle, and this is a brief tutorial on how to navigate your Drowzle provider portal. To access the web-based portal, you will go to the URL shown here, portal.residia.com, and the first time you log in, you will click on Change Password, and then you will input the email that has been set up for your account, and then you can set up your own password credentials and then log in. Everything can be done inside this portal. The first thing that you will do would be to invite patients to use Drowzle. The default is the default home screen is the Drowzle dashboard where you can see the activity, and then you can click on the Email Drowzle Invite tab to be able to input patient emails to invite them to use the program. If you have several patients you want to invite at once, you can separate those by a comma, and then the activity shows up right below that area so you can see how they are progressing through the invitation process. Once patients have started using Drowzle, they will show up in your dashboard like this. The patient's name will be shown as well as their state of residency and the report status. The report status will let you know whether or not their report has been reviewed by either yourself or perhaps a colleague. Once you review the patient's report, you can click on it as reviewed so that you know that somebody has indeed looked at the patient results. That report will get kind of pushed down the list, and the other new reports that have not yet been reviewed will kind of rise to the top. These reports can be sorted by provider if your account is set up that way, by however many results you wish to see, as well as the date, and can be exported as well. If you look at the heading, this is a filterable heading that allows you to be able to sort and triage larger volumes of patients based upon risk. We show you their age, their BMI, their neck size, any comorbidities that they may have, stop bang, Epworth, their apnea count, and whether or not they have a Drowzle recording and when their last Drowzle recording is. In order to drill down on a specific patient information and report, you click on their name, and then you will get to a page that tells you their risk factors, some of the demographic information, and then you can click on Open Report to be able to view the PDF version of their report. Also note here that this checkbox is where you click to mark the report as being reviewed. And then it also tells you how long the report, how much analyzable data, if you will, how many hours of analyzable data are included in this report. So when you click to open up the report, you will see something that looks like this. This is the first page of the report. The patient will also get emailed their own copy of this report. And this first page tells you the demographic data at the top. The patient does input their date of birth. We calculate their age. They put in their height and weight. We calculate their BMI. And then we have these circle gauges at the top that tell the patient and you the risk for the different surveys that the patient completed. So on the left is your sleep apnea risk survey score or your stop bang. It lets the patient know where they are, what their score is with relationship to their answers. So for example, this patient has a 5 and that risk is high. You have the daytime sleepiness results or the Epworth. You have your longest breathing gap, how many seconds that is. And then you also have other sleep apnea risk factor scores here on the right-hand side. So we track whether the patient has diabetes, obesity, or hypertension, and we reflect that back to the patient so they realize that that is a high risk factor for sleep apnea. If the patient has completed these surveys more than once, you will have that information here as well. The graph towards the bottom actually shows the patient how many times that they stopped breathing over 20 seconds. over 10 seconds, the definition for apnea. And you will look at that here, and it tells you down here the total breathing interruptions and how many times per hour. The one thing that I would like to point out is that Drowzle cannot be compared one-to-one with other home sleep tests or with a PSG as far as like AHI and looking at the apnea count. This score right here reflects their interruptions in breathing. We also have some other disturbances that that play into our calculations for our Drowzle Pro that are not included in this graph. But what we are finding is that if a patient has a total apnea count of 11 or greater, that puts them into a higher risk category, just like you might look at your stop bang or their BMI or their whether or not they have hypertension or diabetes. This, as I said, is the first page of this report. It is followed by multiple other pages that give you the supporting answers that the patient gave for the different surveys. The second page of the report, which is what you're looking at here, I just wanted to point out that part of our mission is to educate patients and to always refer them back to their provider. So we want them to understand their risk factors. We want them to understand why sleep apnea is important. And that's what we do in this report. We summarize their analysis. We tell them about the additional risk factors that we're looking at. We're giving them recommendations, which is maybe they want to test again, consult with your doctor. We tell them to look at the different ways in this infographic of how sleep apnea can impact your entire body, right? So it's important to follow up on this. And then there are the other pages that do go over how they answer the questions so that you know what's driving their scores. Some other useful information that I want to point out to you on the portal is that I would encourage you to look at the other tabs. There is a My Tools section, and the My Tools section actually has links to brochures, Facebook posts, a webmaster kit where you can input QR codes or your deep link so that you can invite patients to screen with Drowzle using other means besides just an email address. So we do have some practices that put QR codes onto brochures and they put them in primary care offices, for example, or they put links on their website, or they have a Facebook post. So if this is of interest to you, you just need to request the deep link or the QR code, and then we will give that to you as well. The other idea that some practices had was to have business cards or posters in the office with the QR code. So this concludes the brief tutorial on how to use the portal. There are other resources available to you as well within the portal, so you can review some more comprehensive videos as well. Thank you.